Birds. I've been a lifelong bird nerd, and birds are one of my favorite animals, and I'm just so excited to talk about them with y'all today. And even though the subject is going to be, about death and what to do after death and postmortem exams, I tried to make it, as informational as possible so we can still learn a lot, even though it's a sad subject to talk about. There is so much we can learn from a necropsy, which is a postmortem exam after a bird has passed away. And I realized that it was a topic that's not commonly talked about. And as a veterinarian, a lot of my clients don't know what it is or aren't aware that it's even an option when their bird dies. So I thought it'd be a good idea to talk about that today and let you all know why it is such a valuable diagnostic tool and what we can learn from it. All right, so I did want to start off with a warning and just let y'all know that this lecture is going to cover the topic of death. There will be discussion of deceased animals as well as images of them throughout the presentation. I tried to make it a little less jarring by cropping out so you won't see any like faces of dead birds or anything like that, and just focusing on the organs where the diseases are seen. But just wanted to start off with that. Little introduction about myself. These are my birds. So in the center is actually the bird that started it all, a little budgie named Tiggy. She was my very first bird and is no longer with us, unfortunately, but she was amazing. And even though she was one of the tinier species of birds that we keep as pets, she had such a big personality. So I just wanted to give a little shout out to Tiggy. And then to the left and right of her picture are the birds that I currently have. So I have Wiley and Petrie off to the left, and then Kiwi and Navi. All right, so agenda for this talk, I'm going to try to keep it under an hour or so. And then at the end of the talk, I'll open it up for Q&A. If anyone has any questions, happy to stay and chat as long as you guys need me to. So the agenda, first, we're going to start off talking about what is a necropsy, what's involved in one, when should you have one done, how to prepare for one, some case examples, and then ways that you can prevent common illness in your bird today. So starting off with a definition, what is a necropsy? A necropsy is the examination of an animal after death. The purpose of a necropsy is typically to determine the cause of death or the extent of disease. Just some terminology, necropsy, there's a lot of confusion because necropsy is one word, autopsy is another, and they're basically kind of the same thing. They're both a postmortem exam, but the difference is that a necropsy is a postmortem, meaning after death exam of an animal, and an autopsy is an after death exam of a human. That being said, in recognition of One Health, which is a concept that basically is the idea that we all live in the same ecosystem, we're all living beings, and we often share a lot of the same diseases. A lot of veterinarians are actually switching from calling it a necropsy to calling it a autopsy. And that was just something that I found on actually the website for veterinary pathology, American College of Veterinary Pathologists. I thought that was kind of interesting. So you may hear your vet call it an autopsy, you may hear him call it a necropsy, but essentially the same thing. All right, so what all is involved in a necropsy? First, a physical exam is performed. So the skin and feathers are examined for any signs of external trauma. That's like any bruising or external parasites, lumps or bumps. The bones are palpated to assess for any abnormalities, including fractures. Eyes, ears, and oral cavity are examined for any abnormalities. And this photo, you can see this is actually a live bird. This is just a photo I found online, but it shows something that's pretty classic, known as Nemetocoptes, or sometimes people call it scaly leg disease or scaly face disease. But basically, it's just a mite infestation in birds. So that's something that we would be able to diagnose on, the physical exam. So here are some other findings. These are all also living birds, but these are just things that we may see on the physical exam portion of a necropsy. So on the left is a cockatiel with a little lump that was a lipoma, just a type of fatty tumor. The middle picture is a red lord Amazon with, this one was actually kind of a strange tumor. This was a xanthoma type of fatty tumor of the third eyelid. And both of those tumors were removed, and those birds are doing great to this day. And then to the right, we have a picture of a linealated parakeet with a yeast infection of the oral cavity. That's what those little white spots, if you can make out, there's these little lesions. They're pretty hard to see, but that's something that we could diagnose too on a physical exam of the necropsy. After the physical exam portion of a necropsy, the next step is examination of the organs, and we call this the gross necropsy. And it's not because it's gross, like to look at, like, ew, disgusting, but it's gross because it's with our eyes as opposed to with a microscope. The microscopic portion is something that may or may not be done depending on if it needs to be done. And I'll go into more detail about that later. But so gross necropsy, looking at the actual organs. So to do that, an incision is made through the skin to open the body cavity, and this is done similarly to if a surgery is performed. The internal organs are examined for signs of disease, and we can also get some other information, like if your bird has male or female reproductive parts, we can see that on a gross necropsy. We can also examine stomach contents for foreign objects. To the right is a photo of some little pieces I found actually in the ventriculus of a macaw, and it's not uncommon that we find little bits of things. This was just little bits of wood and probably little plastic pieces off a toy in the stomach of birds, and they actually weren't causing any illness, they weren't causing any issues, and I'll go more into why that is in the next slide. So small pieces of foreign material can be found in the muscular stomach in birds. It's called the ventriculus, and material will often sit here because the job of the ventriculus is to break down large pieces of material that are not digestible really. And then after it breaks them down, it's this muscle that kind of has two different pieces that contract to squish down those pieces. And then it actually retropulses, meaning it pushes them back up into the other part of the GI tract, the proventriculus, where fluid kind of helps to break that down more. And then it's this whole back and forth kind of motion that they do. And I wanted to mention this just because I thought it was a really neat, unique aspect of avian anatomy I think a lot of owners aren't aware of. And just to kind of show something that's also really cool with regards to that movement in their GI tract, I have a video here I'll show you guys of, this is a cockatiel, and this diagnostic study what is called fluoroscopy. It's basically a video x-ray, and so it's taken in real time, and we gave this bird contrast. Basically we gavage fed them contrast. That's what this black stuff is in the crop, and we gave that so that it would outline the GI tract so that we can see what was going on and if there were any issues in there. So it starts in the crop, and then their GI tract continues down about this area would be the proventriculus. And then it continues down. Here's the ventriculus. You can see that little dark gray area is actually the inside of the ventriculus. That's all the material, the barium that's sitting in that stomach. And what's really cool is when I play this video, I want you to pay particular attention to that, because you'll see this really unique motion that it does. And it looks otherworldly. It looks bizarre, almost like a washing machine, but it's part of their anatomy, and it's pretty cool. And if you're wondering what this little thing is, that was actually just a little piece of millet. So that's not part of the bird. That's just what millet looks like on x-ray. So I'll play this video and just watch this little movement right here of that ventriculus. So you can see how it's kind of stopping and starting and stopping and starting. So you can imagine how, those little pieces, when they go down into the ventriculus, they're churning and they're moving, and the muscles are helping to break them up. So sometimes, we'll see things in there like the plastic bits from the macaw on the previous slide, and not necessarily a cause for concern or cause of disease. Oops. So just another side note about, avian anatomy and the ventriculus. Sometimes we'll find gravel in there, but parrots do not need gravel or grit, you may hear it called. This was actually an x-ray of a duck who was eating an excessive amount of grit, but it just goes to show that, this is where the ventriculus sits, that little stomach, and it's full of all that white material in there. That's grit or gravel. And then you can see he ate so much that it's going all the way through his little intestinal tract, his colon, down into the cloaca. It's about to be pooped out. But that's something else, that we can see sometimes in the GI tract. But again, parrots do not need grit. It can cause problems. Don't feed it. I still see it for sale sometimes, and a digestive aid and for your parrot, and just don't do it. It's not good for them. They don't need it. So examination of the organs, back to the necropsy side of things. After we've examined the GI tract, we'll look at all of the other organs, and it doesn't necessarily have to be GI tract first. It just depends on, the clinician, which part they want to look at first. So this is a picture of a heart, actually, with atherosclerosis coming off of the greater vessels. The greater vessels are these blood vessels that are coming off the heart. And this was in an African gray parrot. And unfortunately, they're one of the species we see a lot of heart disease in. Certainly, we see atherosclerosis. What atherosclerosis is a buildup of mineral and fat deposits within the vessel wall, and it causes a hardening and a narrowing of the blood vessel. And that actually can cause heart disease or heart disease. They can be interrelated. But these vessels, we know this is atherosclerosis because typically these vessels are not rigid like this. They should not be, you can see how they're actually standing up on their own. So that was atherosclerosis in a bird. And then the next few slides, I'll go over just some of the more common things that we see, as well as some uncommon ones on necropsy. And these are all diagnoses that we can make on necropsy, so we don't have to do additional testing necessarily for them. So here we've got some pictures of something called hepatic lipidosis, also known as fatty liver, if you've ever heard that term. Basically, what happens in this disease syndrome is fat is stored in the liver, and that can be due to so many things. I think the most common thing is excess fat or excess calories in the diet, but also genetics. If they're a reproductively active female, those things can also predispose them to this. But by far the most common reason I see this in birds is if they're eating a lot of fat or a lot of calories in the diet, especially a seed-based diet. So we know birds don't need to eat a seed-based diet. It's not good for them. But you can see in the middle here, so this is a relatively normal liver, and you can see it's dark brownish, kind of red, and it's fairly small compared to, here's the heart in this bird. And then when you look over here, the camera angle is a little different, so it's hard to see, but this is the heart up here. And then this whole thing right here was liver, and we confirmed on with additional testing with histopath that all of this was hepatic lipidosis, this entire thing. When I first saw it, I thought it might be a tumor or some sort of cancer because it's just so large. But this was in a Bork's parakeet, and over here this was in a budgerigar. You can see again, there's the heart, and then this liver was just taking up almost the entire body cavity. And one thing I wanted to mention about this is sometimes the first sign you'll see of these diseases is that your bird will be having difficulty breathing. And the reason for that is because they actually have bird respiratory system. It's very unique. Their lungs don't inflate. Their lungs are rigid. The part that does inflate, that moves air throughout their body, are actually the air sacs. And air sacs are these thin little bags that sit right along here and up here. They have a whole bunch of them. But if they have this huge space occupying mass taking up the space that those little bags usually use to inflate, and they can't inflate, then the bird's not able to move air throughout its body normally, and they can look like they're having difficulty breathing when in actuality it's not related to their lungs or it's not a respiratory illness. It's actually something in their body that's pushing against that. So that's something else I just wanted to mention there. This is a photo of visceral gout in a budgie. So this is basically secondary to kidney disease. Their kidneys won't be working appropriately, and they'll have uric acid, this mineral, just build up all over the surface of their organs. That's what this white stuff is, and it kind of looks like little salt granules almost. This is a kidney tumor, actually, in a budgie, a renal tumor. And sadly, they are one of the more common species I see these in. So the kidney, as I'll point out, the kidneys have 3 parts in birds. Here's one kidney, here's the other kidney, and the 3 parts, we have this part, the top part is the cranial pole of the kidney, and we have the middle pole and the caudal pole. And so this is our normal kidney here. This is normal, this is normal, this is not normal. This thing right here is the tumor that's growing in the kidney. And this was, we did histopath to confirm it was a adenocarcinoma, a type of cancer they can get. But what's interesting about these, and I think what's important to realize, is that these don't always really present like kidney disease. The signs your bird might show are actually limping on one of their legs or not using one of their legs normally. So there's a nerve called the ischiatic nerve or the sciatic nerve that runs right through the kidney, basically around it. And when they have a tumor like this, and this type of tumor can be in any part of the kidney, as it grows, it can actually push on that nerve. And that nerve is responsible, it runs down the bottom of the leg on both sides. So if they're pushing, if this tumor is compressing that nerve, your bird won't be able to feel it. And it can be a lot of different things. It can be shooting pain, it can be numbness or tingling, it can be so many things, but basically your bird will be acting like something's wrong with their leg, which can throw you off. But usually, that's something that we can see that makes us a little suspicious for a kidney tumor. Another type of tumor that can cause that limping, or it looks like there's a leg issue when there's really not, are actually reproductive tumors. So the gonads, the testicles and the ovaries kind of sit in a similar area in the body. And if they get very large, they can also compress this nerve and cause a limping or cause them to not really use that leg very much. This is a testicular tumor in a cockatiel, and this one was actually a pretty rare presentation of this type of tumor. This was a tumor that started out in the testicle and spread to the kidney. And you can see here, this bird was having difficulty breathing. And again, as I mentioned, it's because this mass, all of this should not be here. That's all the cancer. And it was pushing against the air sac, so the bird couldn't breathe normally. And he was also having some difficulty digesting food and having some abnormal looking stool. And you can see here that this is the intestine running down here. This is the normal feces in there. And you can see how there's no poop really moving normally through that part of the colon. And that's because this mass is pushing on it and causing compression of that area. So this was one that was actually it was uncommon that it had spread to other parts of the body. And this is important because when we learn these things, it helps us to know what's possible, what kind of disease processes are out there. Because I think there's only 1 or 2 reports of this ever happening in the literature. So it helps us as clinicians to learn as well, and then can help us treat other birds in the future. This was a testicular tumor in an umbrella cockatoo. So you can see here, the normal testicle is this little black bean looking thing right there. And then this massive thing was the tumor. And so that was definitely causing this bird some problems. One thing I thought was just interesting I'd point out is cockatoos, actually umbrella cockatoos, have pigmented gonads. So the females will have kind of darkened ovaries and the males will have darkened testicles. So it's just kind of a unique species thing for them. This was aspergillosis, a type of fungal infection in an umbrella cockatoo. And those air sacs that I mentioned, you can see this kind of thin opaque looking tissue here. That's the air sac, and normally that should be clear, almost like a sheet of cellophane. But the fact that it's got all of this, what we call opacity, all of this kind of whitish, yellowish coloration, that's all abnormal. It should be pretty much clear, translucent to clear. And then this right here, this almost looks like a piece of bread mold there. That is literally mold. It's the fungus. It's Aspergillus. So that was another diagnosis we made on necropsy. This is a picture of a red-fronted parrot with sarcocystis. So this is actually a lesion in the lungs, and that's one of the more common places this organism can go. The organism is a protozoan parasite, and basically it was infecting the lung and causing all of these issues. Respiratory distress. It ended up being fatal. We found it on necropsy, but we were able to give the owner some answers as to what was going on, because no one knew why this bird was struggling and why it was having problems. And what was very helpful with this too is we know that sarcocystis, this type of parasite, can be carried by possums and also cockroaches. If they come in contact with possum feces, they can actually spread it. So that gave them a little more information about, how to prevent this from spreading to their other birds. And this is just a picture of the histopath, which I'll get into a little more detail about exactly what that is. But basically, this is a microscope slide, a picture of a microscope slide from, it wasn't this bird, but it was another bird with the same disease, sarcocystis. And they used a special stain, and they were able to identify, and they did a similar thing in this case, where they were able to identify that was the organism affecting the bird on histopath. So additional testing that may be done after the gross necropsy is performed. Gross, again, remember, meaning that just looking at it, your veterinarian looks at everything with their eyes as opposed to with a microscope or doing other tests. So we can also do testing that includes histopathology, culture, PCR, and cytology. And I'll go into each one of these in a little detail. So histopathology is the study of the signs of disease using microscopic examination of either a biopsy, surgical specimen. It's just a piece of tissue basically, and it's processed at a special lab and then put on glass slides. And then a specially trained veterinarian who has undergone years of additional training, called a pathologist, will look at that tissue, and then they send that information back to us, to the clinical veterinarian, and they tell us what they're seeing and help us to make a diagnosis. And I just wanted to give a shout out to veterinary pathologists everywhere, because they're just incredible people and veterinarians, and we couldn't do what we do on our part as clinicians without them. So now this is a case of histopathology where Aspergillus was diagnosed in a penguin, and I thought this was just kind of cool. I wanted to show you guys, what they're seeing and how they're making these diagnoses. So this wasn't my case, but this was a case I got permission to share with you all from the pathology group, the Joint Pathology Center. They're wonderful. They have some amazing pathologists there. And you can see on this slide, this is a picture of a section of the lung in this penguin. This little white part labeled with a B is the bronchi. That's one of the airways. The V is a vessel, a blood vessel. You can see the blood right there in the vein. And what they found was this bird had a lot of granulomas surrounding the airways. That's what these are right here. This pink stuff is dead tissue. It's necrosis, basically. And surrounding that tissue, all that purplish, and then it becomes blue, those are all the inflammatory cells, also known as white blood cells, that are coming around and surrounding that and basically trying to fight off an infection. And the body's walling this off and making this granuloma to try to fight the infection. And when they looked at the core of that granuloma, they found the source of the infection. And you can see these arrows are pointing to this. It's kind of hard to pick up, but it's like a little lighter pink than the rest of the crazy looking background there. And it's this stick-like organism here. So this is actually the fungus Aspergillus. So they were able to make that diagnosis on histopath. Culture is another test that we can do. Culture is a test that looks for the presence of bacteria or fungi. A culture involves basically you get a little swab and we swab the tissue or any type of bodily fluid, send it to the lab, and they process it. They have these little agar gel plates. Agar gel is just what grows bacteria. So they grow it on here and then they're able to identify which organism is in there. And it's not a perfect test. Sometimes the organisms are very sensitive. All bacteria or different funguses are all different, and sometimes they require a very specific temperature to grow. So if they're not grown at that very small specific temperature range, they won't grow. So you can do a culture and you won't necessarily get results. And it doesn't mean that there was nothing there. It just means that the bacteria or fungus was super sensitive and wasn't able to grow. PCR is another type of additional test we can do, stands for polymerase chain reaction. And basically it looks for the DNA, so the genetic material of organisms. So it's a little better in the sense that we don't need a living organism to test for it. So I mentioned some bacteria are really sensitive and they don't survive the trip to the lab, or they don't survive, they won't grow on culture. They can be dead, and as long as we have that DNA still there, we can do a PCR and still identify it. The downside to PCR is that you have to know what you're looking for. You can't just search for any possible organism out there. For example, there's not just a virus PCR that will tell you all of the different types of viruses. There are PCR panels that will look for specific groupings, but you kind of have to know what you're looking for and say, I'm suspicious for this disease, let's look for that disease. So it can be super helpful in cases if I see something where I'm suspicious for like chlamydiosis, or psittacosis, and we can send in that tissue and see if that's the case. There's a newer type of technology called next generation sequencing that's really exciting. And basically it looks for the DNA and RNA. Those are the genetic material, the genetic building blocks for any organism, any living thing. So bacteria, fungus, all those guys. And they can see which organisms are present in that material, but they can also identify how many of them there are. And this type of technology can be a little tricky because there are microbes all over the body, right? We're constantly covered in microbes. So if I just took a swab of, one piece like the skin on, your bird, I would grow so many different things. Not all of those things that I grow or that come up on this test are going to be disease causing. Sometimes they may cause disease, sometimes they may not. So we have to interpret these results very carefully as a clinician to see, are these things lining up with what we're seeing clinically, or the lesions that we're seeing on the organs? So it's a very exciting, newer type of technology that I'm sure is only going to become more, advanced. We'll learn more about it and kind of perfect it the more we know. But I just wanted to mention that because it's a pretty cool, newer type of test we have. Cytology. So cytology is the examination of cells on a slide under the microscope. And it can indicate sometimes if there's evidence of infection or cancer or parasites. And basically what we do is we take a sample of a tissue or fluid and put it on a microscope slide, look at it under the microscope, and we'll often use special stains to identify and highlight certain organisms. And that can sometimes help us make a diagnosis as well. Sometimes cytology can be done in-house right there at the vet clinic, but sometimes it does have to be sent out to a lab. So this was one, I actually made the diagnosis of Aspergillus and we confirmed on histopath in-house. So you can see this little line right here, that's actually the organism, that's the fungus, Aspergillus. These things you see here are all white blood cells. This is kind of interesting. You can see this is a macrophage. That's a type of white blood cell, and it's big and has all these what we call vacuoles, these little white bubbles, because it's trying desperately to fight off that fungus. It's trying to fight the infection. That's what white blood cells do. Birds also have heterophils, a type of white blood cell. This is a heterophil, and he's got his little granules in there. So cytology, I think, is also just so pretty to look at. So I could nerd out about this all day, but this isn't a talk about cytology. So we'll end that there. So the importance of additional tests, why do we even do additional testing in the first place? Because it does cost more money. Each of these tests, they can be expensive. When would we do them? We can do them if there are no significant findings on the postmortem exam. So if we look and we see absolutely nothing different or abnormal, which unfortunately can happen. It's not common that happens. We usually see something, but it can happen. And tissues can look completely normal, grossly, and then we send them in for testing and we find all kinds of stuff going on. So that would be one example when it would be good to do additional tests. Also, sometimes we'll look at tissues and we'll see something abnormal, but it's not specific. So like if we see a lot of pus or purulent material somewhere, we could say, hey, it looks like infection. We don't know what type of infection it is, and additional testing could help us figure that out. No test is perfect though, and findings unfortunately sometimes can be inconclusive, meaning, we may not reach a diagnosis despite doing additional tests. That's always a possibility. So why should you have a necropsy done? I thought about this a lot, and because there's a lot of benefit to having one done. And one reason is if death was unexpected or sudden, which unfortunately, as we all know, it can happen in birds because they're prey species, and the parrots that we live with are prey species, and they will often hide signs of illness. So sometimes their death can be sudden and without any warning. So sometimes doing a necropsy then can help. You can also do it to protect your other pets by trying to learn if there was infectious disease present. You can also provide insight for clinicians, veterinarians, to help their future patients, and also just to obtain closure on, why your pet passed away and what was going on. So as I said, birds can hide signs of illness. Sometimes the first sign can be sudden death, especially with things like toxins. Gaseous substances can cause that too. Things like, Teflon toxicity or smoke inhalation. Infectious disease, it can spread from birds to other birds or to humans or to other animals. There's so many different types of infectious disease out there. And they can actually carry infectious disease for certain types of diseases and spread them to other animals and show zero signs of illness. So that's something else that we can sometimes find evidence of. So really, if you have other birds, it is very important to have a necropsy done if your bird passes away, just to look for signs of infectious disease to protect the rest of your flock and make sure there's nothing, that could have been spread to your other birds. There are many diseases in birds that have not been well described in the literature. As I mentioned, with that type of testicular tumor we found in the cockatiel, that was not, there's only a handful of case reports out there about that. So what we learn sometimes on necropsy can actually help and contribute to publications to help other veterinarians learn, about disease processes, how they occur in the body, and hopefully one day lead to treatments for those diseases and help future birds. Findings can also help with clinician training as well. Last reason to, have a necropsy done is just to obtain closure. I myself have had, my pets pass away and I didn't know what was going on. And it wasn't until we did a necropsy and I was able to see exactly what was going on. In fact, just last year, one of my lizards, a bearded dragon, he was just wasting away. He wasn't doing well. And it wasn't until I did a necropsy and sent in tissue for histopath that I found out he had cancer. And that wasn't showing up on any of the other tests we were doing. And that's the sad reality of a lot of these guys is they can have disease and the blood work can be normal, x-rays can look okay, or they may be abnormal, but not specific for certain things. So for that situation, I got a lot of closure knowing that, that was something my little beardy wasn't going to come back from, that he had cancer, and gave me some closure that I knew I made the right choice, and letting him go when I did. So preparing for a necropsy, it's very important that you never freeze your pets if you can avoid it, because that does destroy some of the tissue and it can prevent us from reaching a diagnosis. But I would recommend calling your veterinarian first to see if they can perform a necropsy, because not everyone does or offers that service. Bring your pets remains to the clinic as soon as possible, because the sooner you can bring them in for the necropsy, the better the results will be. Sometimes if you wait too long, the tissues start to break down and they won't be able to get you a diagnosis. If you're unable to bring them in right away, though, you can put them in a cooler or a refrigerator. That will help preserve some of the tissues from breaking down. And then also find out your options for aftercare and let your vet know your wishes ahead of time if you want to do a home burial or a private cremation. Sometimes veterinarians, we can perform what's called a cosmetic necropsy. Basically, we make a small incision and take a quick peek inside and then suture everything back together. The reasons we would do that, sometimes people want to be able to look at the body afterwards. The downside to a cosmetic necropsy is that when we do that, we get a small percentage of information that, we get more information basically from doing a traditional necropsy. So you can still see some stuff, and sometimes we get a diagnosis on a cosmetic necropsy. So it's never wrong to request one if you're kind of on the fence and you're not sure if you want the full necropsy, but you just want a cosmetic one. That is an option at some clinics. So I would always ask your vet if they're able to do that beforehand. Your veterinarian, typically after doing the necropsy, they'll call you with the results, typically within a few days. And based on the postmortem exam or concern for certain disease, they might recommend additional testing. Sometimes the cause of death is not found on necropsy, and I would just prepare yourself for that, because I've been through that too, actually, when one of my bunnies passed away years ago, and we did a necropsy and never found out why. And it can be heartbreaking when it happens, but at the very least, I was still glad I had it done because, it helped me to learn that there wasn't anything, at least obviously infectious, that was going to affect, my other animals. Ask your veterinarian about their services for aftercare. So every clinic's different. Some of them offer cremation or preparation of the body for a home burial, or care of body, which is when they have them cremated and the ashes are taken care of by a local pet cemetery for you. So I'm going to go over just a few quick case examples here. And for the purposes of this talk, these case examples were actually chosen because they needed additional testing to make a diagnosis. But as I showed you in the images earlier, we don't always have to do additional testing. A lot of the time we can make a diagnosis just on gross necropsy. So case one, this was a unknown age, unknown sex budgie that was found outside. He died at home. He or she, I guess, died at home after sitting on the bottom of the cage for 2 days. So on the gross necropsy, really the only findings that we saw were the bird was significantly underweight and had a lot of pectoral muscle atrophy, which basically happens when a bird isn't holding on to their weight. The pectoral muscles are the big chest muscles. They're the biggest muscle in the bird's body, and they naturally will start to kind of weaken and get thinner if a bird is really underweight. So we knew the bird was skinny, but we didn't know why. So we did histopathology, and fortunately that gave us our answer. So this bird, this was just copy pasted from the histopath report. The proventriculus, you can see here, excuse me, I just need to get a drink of water. Sorry about that. The proventriculus, there was yeast in the proventriculus consistent with something called Macrorhabdis or Niphogaster. I'm so sorry, I have a tickle in my throat. But basically, Macrorhabdis or Niphogaster is a type of yeast known as avian gastric yeast. And it's an infectious disease that can cause chronic wasting despite a good appetite and eventually death. So that's what this little birdie had. And this was actually really good. We found this because the owner was interested in getting another bird. And because they found out it was an infectious disease, they decided to start fresh with new everything. What this bird had touched, they just got rid of and got new things for their new bird so it wouldn't be transmitted. Case two was a 5-year-old female Alexandrian parakeet that presented for chronic weight loss despite a good appetite and reduced fecal output. Now, due to patient suffering, because the bird wasn't doing well, their owner did decide to let them go with humane euthanasia. On the necropsy, we did find that there was a firm mass of feces in the intestines with no fecal material beyond the blockage. Fecal impaction or constipation is not really a common thing in birds. So we knew there was something wrong, but there were no other clues as to exactly what was going on. So the next step was histopathology. And what we actually found in this bird was ganglioneuritis in both the small intestine and the ventriculus. So avian ganglioneuritis is an infectious disease that can cause neurologic signs or GI signs. And in this case, the signs were associated with the GI tract and caused the chronic wasting and likely the fecal impaction. The owner was comforted, learning that they had made the right decision and saying goodbye when they did. So that was a good outcome for that case. I am so sorry, you guys. All right, this is our last case, case 3. So this was a 24-year-old female severe macaw that had a history of significant crop distension. The crop is that big bag that kind of sits right here on this part of your bird, and it's an outpouching of the esophagus. And this crop was not emptying normally, and it was just getting really, really big. Despite diagnostics, a cause was not found, unfortunately, and this bird did pass away at home. So we did a necropsy, and on the necropsy, we found crop distension, enlargement of the crop, which was, not surprising. But we didn't find any other clues as to why it was distended. I mean, the tissue looked normal. There was no infection, no inflammation, no other clues. So we sent it into the lab for histopathology. And it was when it was looked at on histopathology that the diagnosis was made of adenocarcinoma. Adenocarcinoma is a type of cancer, and cancer can occur in any organ, in any animal. But this type of cancer, adenocarcinoma or primary cancer of the GI tract, is not very common in birds. And in fact, it's been reported in budgies that also have concurrent avian gastric yeast infection, but not in this species before. So it was very unusual. The diagnosis not only brought the owner closure, but also added to our knowledge base for cancerous conditions in birds, because this type of cancer is really uncommon, and to my knowledge hadn't been reported in this species before. So last part of this talk, we'll go over some ways to prevent common illness in your bird today. Diet is huge. There are so many different common illnesses in birds that can be either helped or avoided altogether by getting your bird on an appropriate diet. Omega-3 supplementation is really important because it can support cardiovascular, renal, and joint health. I would recommend letting your bird fly if it can be done safely. It's one of the best ways for your bird to exercise. And, birds were meant to fly. That's why they have wings. So if it can be done safely, I definitely recommend that for their health. Don't just bring your bird to the vet for a checkup, for a physical exam, but let your vet do some tests, because there's oftentimes things that we see on blood work or a fecal test or some other form of testing that they weren't showing any signs of on physical. So testing is really important too. And then weigh your bird regularly, because sometimes when your bird is sick, weight loss can be the first sign that something's wrong. And birds, they don't show that they're overweight or underweight just by looking at them the way mammals do. So the scale is really, really important. And here I've got a picture of a really cute little macaw on his scale. He's checking out his weight there. And you can get these little gram scales online or in the store. They also sell perches that you can get and teach your bird to perch on it. It does take time though, and persistence, because most birds are scared of new objects. So it'll take a bit of training to get them used to, but that's one way you can weigh them. Another way, if they're not willing to learn, or it's too much stress to learn how to stand on the scale itself, you can put them in their carrier, their little travel cage, and put that on the scale, and then just subtract the weight of the cage to get your bird's weight. So in summary, there are many benefits to having a necropsy performed. Information gleaned from a necropsy could help you protect your other pets, bring closure, provide insight to your vet that could help them with future patients, and also provide information that could be valuable to the future of veterinary medicine and furthering medical advancements. Again, all to help, more birds in the future. And with that, I just want to thank everyone for sticking this out, especially when my throat was having some trouble there. But I just so appreciate everyone taking time out of their day to come to this talk. And am very humbled and honored I was able to give this talk. Thank you, Anne and Phoenix Landing, for asking me to. And now I want to open it up for any questions.
Yes, thank you. That was supremely wonderful. You have such a gift for explaining things in a way that help those of us understand it at all levels. So we really appreciate that. You clearly are good with your clients, I'm sure, for that very reason. And this is not an easy topic. So thanks for taking it on again. And Dr. Orris was with us, but she had to disconnect and go to a different location. So she may join back in again in a moment. I'm sure she has plenty of thoughts as well, but you do have some questions, and I'm sure there will be some more. Okay. But to start with, you had talked about how important it was to not put a bird in the freezer, which is something we repeatedly remind people because that's what your instinct might be, right? But when you put them in a refrigerator or other kind of cool place, is it helpful to wrap them in a wet towel or something wet also?
Nope.
No, I've always heard that, so that's a myth, huh?
I guess so. Yeah. I'm trying to think of why someone would recommend that. Yeah, I would just say, paper towel in a bag, like a Ziploc bag. Because if you're getting it wet, one of the things I worry about is that you're actually putting an abnormal amount of moisture on the tissue, and that can encourage the growth of bacteria and other organisms that can further degrade the tissue. So yeah, I'd say just, keep them dry and just wrap them in paper towel and in a Ziploc or something.
Okay. Okay. And then how many days does one have? Say, the emergencies always happen on Saturday night, right? So how many days do you have before you can get somewhere to get a good result?
To get a good result? Oh, it's so variable because it depends on the condition you're trying to diagnose, and each condition has a different window of time. As soon as possible is always best, but within a few days we'll give you something, and eventually there will be a time, like you don't want to do this like months later, but I don't know, there's so many things and it depends on what disease process you're wondering about. So if it's been a while, the best recommendation I can make is to call your vet and tell them how long it's been, and then they can let you know, depending on what you're worried about, if it's been too long.
Because there's probably some cost benefit ratio where, too many days means the results are not as informative anymore, right? So totally.
And it depends on the tissue too, because like I'm trying to think, like if there was like a big tumor, in this area part, then in the coelomic cavity, kind of like the abdominal cavity in birds, that could be something that you might see even if the rest of the tissues around it are breaking down. So depending on the diagnosis, you may or may not be able to see things past a certain number of days.
Yeah.
But the sooner is always better. You'll get much more accurate results within a few days of death.
Yeah, agreed. It's just, why did the emergencies always happen at those inconvenient times, right?
I know. And they happen to vets too. Even I've gone in when we're closed and I'm like, oh my gosh, like my crisis on a Saturday night.
It's inevitable. Yeah. It's terrible.
Yeah.
By the way, I just want to let everyone know, I meant to say this at the beginning, Dr. Magnotti has kindly agreed that we can record this today so that we can upload it to our event recordings page on our website, because there's always something new we get out of each event when we go back and hear it again, especially if we need information about this topic at some point. So several people wanted to know what things look like under certain emergencies, like what does it look like when a bird has died very quickly from toxins or tough canary in the coal mine? Is that going to look like a lung issue? How does that look?
Oh yeah, yeah. So typically with Teflon toxicity, the lungs will be very what we call congested. They'll be very dark red. Usually they're light, fluffy, kind of pink color, but they'll be dark red. The tissue will be very not firm, but more congealed. Like there's a lot of blood in there, and we can see that on histopath too. They can give us some more information that makes us lean towards a diagnosis of Teflon toxicity.
And that's usually something you can see with a gross necropsy. It's pretty evident right away that it was something, especially because prey animals, we all know sometimes they just die really fast. We had no clue. I can't tell you how many relinquishing forms we get, probably half, where the question is, when is the last time your bird has been to the vet? And the answer is never, never looked sick, didn't need to, because that idea of a prey animal just suddenly dying is not part of their experience. And we unfortunately had a couple of macaws die recently, very quickly. One, while I was talking to them on the phone about the other one, because they had bought some kind of protective thing that they sell to put on stoves to catch the grease.
Oh,
And it started
no.
to melt, and the whole family ended up sick. It just happened so fast. There are just so many potential canary in the coal mine things out there that sometimes
Yeah.
we learn the hard way, right?
Yeah, absolutely. Yeah.
So the lungs is that what that's going to
With
look
the
like?
lungs, yep.
Mhm.
Typical lesions for, yeah, any type of Teflon smoke inhalation. Yeah, really those airborne toxins. Usually the lungs are affected. And
Mm,
with Teflon especially, just a lot of hemorrhage in the lungs usually.
mm.
Yeah.
And that happens very quickly, right? I mean, over a certain degrees, Teflon over a certain degrees is
Yeah.
toxic to us probably too, I would think.
And ovens are another one I find a lot of people don't realize, but a lot of ovens nowadays, they're actually they're lining them with Teflon. So if someone is doing like an oven cleaning session where you push the button on your oven and it does the cleaning thing, get your birds out of the house for that, because that can cause Teflon toxicity as well.
Oven cleaning, what other things? Just so,
Oh gosh,
we
so
can help
many.
people avoid a problem that
Yeah,
they didn't think
totally.
of.
Any any type of smoke. One thing I see people talk a lot about are like those soy candles, and that you can still burn soy candles around birds. I would recommend just not risking it, because they still put off smoke, and any type of smoke could technically cause damage to your bird's respiratory tract. So no burning things, no candles, no strong scents. For cleaners, usually if like you can smell it, it's probably too much for your bird. Some safe cleaners to clean your bird's stuff with are just plain old Dawn dish soap and some warm water. I mix that up in a little spray bottle, and that's what I clean my bird's cage with. Apple cider vinegar mixed with water is another natural thing you can clean their cage or their environment with that's safe. Um, but yeah, just nothing too like really stinky and chemical smelling for cleaners.
We're big fans of chlorhexidine here, diluted chlorhexidine. It
Yeah,
doesn't leave a residue and it kills a lot of bad stuff in the process. Yeah.
absolutely. Yeah, if you can get some Chlorhex and mix that up, I think
Yeah.
they sell it at a lot of like pharmacies and stuff.
Yeah. It's
Yeah.
usually about $20 on Amazon for a gallon. And that lasts most people with only a few birds, unlike us that have a cast to take care of here. But then what about if a bird gets too hot or heat stroke? What would that look like in a necropsy?
Oh, that's one I have not seen personally, so I can't comment on that, unfortunately.
I would think that'd be pretty rare, right? I mean, we've seen the birds in the wild in
Yeah,
110 degrees plus panting,
yeah,
but
yeah,
don't die.
yeah. So I'm not sure about that one. That's a good question though.
Hmm.
Yeah, yeah.
Um, we talked a little bit about species, which I thought was appropriate since we encountered that as well, like with the African grays and heart disease. It just seems like they're all getting heart disease these days. Do you have other, I think the people with us today have a wide variety of species. Do you have other kind of common things that you see by species that maybe they should be aware of?
Yeah. So there are lots of common things. So as far as atherosclerosis, that's one of like the most common disease processes I think that I see in birds on necropsy, unfortunately. And the tough thing about athero is that you can't it's really tough to diagnose before they pass away. So the best way to prevent it is getting your bird on a good diet and feed them omega-3s. Omega-3s are huge for so many different things, including not just preventing atherosclerosis and helping out the heart, but also the kidneys, the joints. So omega-3 supplements are great, and making sure your bird's not consuming excess calories or too much fat. One thing I see a lot of that I think people don't realize is that feeding your bird a lot of animal product, eggs included, can cause atherosclerosis or heart disease because it's a lot of fat, a lot of cholesterol. So we want to make sure, we're not doing that. But yeah, that's probably one of the more common ones. And then related to that, hepatic lipidosis or fatty liver disease that I mentioned, that's one I see very commonly in budgies. And let's see what else that's species
And
specific.
then just to help people here, reminders, if they're not at our classes often, omega-3s would be flax oil, flaxseed, hemp, chia, walnut, pepitas. Stephanie Lamb, Dr. Lamb recommends krill oil, which surprised me. What other things do you recommend?
Yeah, all of the above. Yeah, absolutely. Thank you so much, Anne, for reminding me about that. Because I
Eggs
often
too,
forget.
but there's the good
No,
and the
there's like
bad,
that.
but an egg yolk is like perfect. Yeah.
Yeah, right. So Harrison's actually just put out a product, or I'm familiar with it as of recently. Maybe it's been out for a while, but it's a mixture. It's called like omega-3 or Jumpstart Omega or something, but it's just a mix of like hemp seed, chia seed, and flax seed. You can get that pre-made, or of course you can just drive on down to the grocery store yourself and make yourself a little mix. I give that to my birds and they really enjoy it. The
I
other
use it as like a condiment on top of the fresh food. It causes
Yes.
them to eat more of the fresh food.
I do exactly that.
Little seed, yeah.
Yep, a little bit of like Parmesan cheese, not actual Parmesan cheese, but it's like that's what the flax
That's the
seed
concept,
is.
right?
Yeah.
Exactly.
Yeah.
Exactly.
And then of course there's Dr. Eccles Vet Omega supplement, which is wonderful. And that's one that actually has data, proving that the amount that you're giving the bird is what they need. So as far as yep, that too. So as far as one that's going to be probably the most effective, because the amount you're giving them is the amount they need, that's probably one of the better ones. But a little bit, there's nothing wrong with giving them a little bit of chia seed or flax seed, that's always going to help them out.
And just to remind folks that the omegas break down really fast, so don't shake the bottle.
Yes. Yep. If you're using,
the natural thing to go shake the bottle, right? Yeah.
Absolutely. Yeah.
Going back to the toxins, there were a couple of people I know who've had. Oh, good. Dr. Orris is with us.
Hi, Dr. Oros. Good to see you.
You can add walnuts in.
Yes, the walnuts, exactly.
And then Dr. Claesing would say pumpkin. And this is the great time of year for pumpkin.
Oh, yeah.
Put it on a skewer, go to town.
Yeah.
Yes. So a couple of other of the airborne toxins. Somebody wanted to know about air fryers and the venting air from air fryers. Have either of you ever encountered anything like that?
I can't say I have.
I know unvented gas stoves in the house can be a problem. It's important for them to be vented, but I wonder if an air fryer has that.
I don't know. Dr. Oros, have you heard of any issues with air fryers and birds?
I think so. In that what'll happen is the little fat globules can get into the lung tissue, and then it acts as a foreign body.
Gotcha.
So that would be something you wouldn't want to do in the home or anywhere near the birds. And then the other thing that they have to be careful of, because you had mentioned Teflon before, which is, I don't know if it's still on the same subject or not, but there's a lot of things now that have Teflon on it, like the paint on your walls. You can have Teflon, those, the washable surfaces, the Teflon that's in a lot of these stain resistant upholsteries. So those can heat up on a hot day going through the window, and then you can have a problem.
Wow.
Not as much as, the old Teflon overheating by itself, but still.
How about kerosene heaters? Somebody wants to know.
Bad.
Bad.
I mean, birds are canaries in the coal mine, right?
Right.
And so they've got to be careful. And, if it's a problem for the bird,
It's a problem for us.
yeah, it's just there's a lot of lobbying going on in the United States. So that's, the Teflon is one of them. It's going to affect the bird. It's going to affect you. It doesn't kill you as fast.
Exactly. I know when I cut certain things out, like Windex, and then suddenly I smell it again, it's just horrifying that I ever tolerated that at one point. So we start to get a sense of how the birds must feel around perfume and Old Spice and, those kind of things. And I'm sure wood burning stoves, another not so good thing.
Not so good.
Febreze.
Horrible.
I wouldn't. Yeah.
Yeah.
I lived through the Febreze generation where we had a lot of birds die from that.
Avocado oil used as a fryer, if somebody wants to know.
Probably not good.
Yeah.
That would actually get into the air and have the same effect as an avocado seed.
It could. I wouldn't trust it. And the other one is that I had happen to a client was they gave black walnuts. So there's always that potential for the shell. And that was highly toxic to the bird too. That's another toxin that's kind of odd, but true.
Yeah, some plants, it's okay for the bark, but not the leaf, etc. So
right.
We like
maple.
Somebody wants to know if they're moving into a new apartment with a new electric stove, should they turn on the burners first to make sure there's no smell? That's really hard to know. I don't know about electric versus gas, but doesn't hurt to get it out.
It's a good idea anyway, because sometimes the people will be cleaning it with a cleaner before it.
Right.
So I would, just in case.
Anything else about certain species and their proclivities to certain problems? Like avian gastric yeast, we have never had this issue that we know of, but it's a fear of mine. How do we know when we should, if a bird is not feeling well, how do we know when that's the right test to give? And what are the symptoms?
So that's actually a really tricky one because avian gastric yeast is something that a lot of birds can carry and never show any signs of, and they can actually transmit it to other birds, even if we call them asymptomatic carriers when they're not showing signs. Sometimes we can see it on a fecal test, a fecal gram stain. So that's one of the reasons, we're a fan of recommending those and checking that out, but they intermittently shed it. So just because you don't see it doesn't mean they don't have it. But classic signs are, if they're losing a lot of weight suddenly and just kind of aren't doing well. I know that's really vague, but and then the species we see it mostly in are budgerigars, unfortunately. But theoretically it can be had, by a lot of different parrots.
Well, since we tend to test for certain things like chlamydia because they are so contagious and we don't want them spread to the rest of the population, should we be considering testing for avian gastric yeast, for at least for some species, as a routine preventative?
The reason I wouldn't recommend that is because of the asymptomatic carriers. So let's say you have a bird, well, I guess it never hurts to have more information, but I'm a fan of, always trying to get the best use out of the funds of the client that I can. So it's not right or wrong. I think that if they have a bird though, who, isn't going to be around any other birds and we do the test and it's positive, but the bird's totally healthy, we don't have to do anything about it, because there can be asymptomatic carriers that aren't sick. But on the other hand, it would be good to know then if the bird does start to show signs of it, then we can have an idea of what to treat. So I don't know that that's an easy question to answer. That's a good point though, for sure.
Yeah.
I think typically though, what Jessica's saying is that it's going to be really hard to pick that up.
Until it's
And
too
real,
late.
and particularly avian gastric yeast, it's tricky.
Mhm.
And so even if you do PCR on it, because it's intermittently shed, it's going to be a tough one. It's really more, does the bird have signs? And you can see it in some of the small species, you know, the one that are more prone, I think she said this already, cockatiels. I had to run over it. So the cockatiels, parrots, you know, you have to assume the parrot has it until proven otherwise.
Oh, the
They'll get, yeah, parrots will, they're more the asymptomatic carrier type bird too. But you'll see a bird with a big crop, and it could be an Amazon, it could be, you know, it could be a macaw. Don't see it as commonly, Jessica, to you, in old world species, other than like the lovebirds. So it depends. And then Dr. Leertz did a study, and the problem he found, I think the data was that 70% of birds that had avian gastric yeast in the population he did were also positive for Bornavirus. So sometimes those things are linked because the avian gastric yeast tends to hang out in GI tracts that are not functioning properly. So you might not see this until the bird is older, because their immune system doesn't work as well. You know, so there's a lot of compounding things, young and old.
Bornavirus is one of those complicated issues that we've all been trying to tackle and understand and not overreact to at the same time, since so many birds have it. But I've always wondered, has a bird ever actually died from only Bornavirus, or is it just that the Bornavirus triggers?
Yes, they die
From Bornavirus.
Yes.
Okay. It's
I
not
mean,
that it just causes other immune system issues. They actually.
yeah. So I've seen, you know, I've been around really a long time, and it has changed form. I will admit to that. But it has definitely caused a lot of birds to die. Dr. Delhausen and I, that when he started working on those diagnostics tests in about 2004 or 5, we were getting birds shipped in as young. Yeah, this is the generation where there were a lot of parrots sold still at pet stores. And these young birds were mixing, and then they were going to pet stores, and emaciation and death, because their digestion isn't working. You know, their digestive tract isn't working right. Those are the ones that tend to die, are the GI sign ones, faster. Although I've had African grays that are neurologic that die too.
Mm-hmm. Just from the Bornavirus. Okay.
Just from the Bornavirus alone.
And so everybody knows, don't panic. Lots of birds have Bornavirus, and it doesn't.
Right.
There's a problem.
Absolutely. Yeah. So because you asked the flip side of the question, most of them can be positive, and they're just looking at you like they're fine.
Right.
And so, you know, a long time, well, I don't know, let's say 15 years ago, I had this, when this whole big thing was coming out about Bornavirus, there was like, we had these birds die. We had like, it'd be a rescue, and they may have had like 15, 20 birds in a room, and 2 birds die. And it's usually, you know, something set them off, there's stress, there's all kinds of stuff. And they die, and they do autopsies, thank God. I call them necropsies, but people call them autopsies. And so they go, oh my God, they had Bornavirus. And then the veterinarian would say, oh my gosh, we got to test everybody in the room, right? Jessica, you've been through this. So then you go through, well, we got to test them all. We got to test them all. And then they go, oh my God, there's an outbreak. There's like 50, 60% of the birds in the room are positive. Absolutely they were. They were that way before they went into the room, for God's sakes, you know? And they're just sitting there smiling at you. And they're going to continue to sit there and smile at you. And they can typically die from something else.
That's what I thought. I thought it just compromised them in a way that something else actually took
Usually,
over.
yeah, well, I mean, it's because their immune system isn't right to begin with.
Mm-hmm. I mean,
And then the question is, how did all that go about? And Dr. Lirtz is working on that now. He's doing some very early chick fetus studies. Oh no, it's not Dr. Lirtz. It's Monica Rinder. And so they're looking at how, and he's doing some studies also to look at this thing, which essentially, it wasn't my idea. I keep telling them that, you know, Helga Gerlach told me in 2007, it was transmitted in the vitelline membrane of the egg, she said in her German English. And I keep repeating that. And then finally, let's see, what that was 2007. Let's see, now we're 2022, and we finally get the Germans to actually do some of the original studies, and voila, it's in the embryos.
right.
Hello.
You've been telling us that for a long time, and that it didn't.
Yeah, I mean,
affect
I
how we
recognize
rehome birds.
yeah,
Right.
there can be other ways too, but so it's an immune disease related, but a lot of things are, right? I mean, Jessica's showing you things, you know, the immune system falters in some way, and then something happens, cancer or infection, and then the bird dies, right? And I mean, that's for any kind of every animal.
Right. Somebody wants to know what the yearly or, you know, bi-yearly or how often you recommend blood work should include, which is a great question because we're always doing lots of lab work with our birds.
Yeah, no, that's a great question. If it's just routine, I would say a CBC chemistry panel is kind of the go-to, you know, I think for most vets. CBC looks at the red and white blood cell count. Chemistry panel can look at organ function, electrolyte values, some other things. And if you can get bile acids in the chemistry panel, you know, that'll give us some information that could be helpful for liver issues, because that's something that is not always included in every chemistry panel, depending on the lab.
We always request that, since that, to me, lab work is showing us mostly about liver, kidney, and if we're finding an infection. And so we need that bile acid for liver and uric acid for kidney. And
I have to tell you that I would gram stain first. and then it would depend on the bird, right? And depend on the situation of the bird.
Can you explain what you mean by you would gram stain first? How is that a fecal gram stain?
Fecal colloidal, fresh fecal colloidal. And then the next question on the blood work is, a lot of people get tied into the blood work. I think that the blood work is needed, but if you have a bird that typically isn't going to start to show signs until of aging until they're around 20.
Mm-hmm.
You need to do that every year in a macaw? I don't know. Maybe, maybe not. I mean, I'm just asking that question. That's what I ask myself and my residents. But I sure shouldn't. I'm also, depends where you are in the United States or where you are in the world with your birds in terms of infectious diseases or what they show you. So Brian Spear listened to me talk about gram stains one day. And he said, and I do a co-anal and a fecal. And he said, you know, you're really doing it more as a cytology and an overall health screen. That is exactly right. So it's not just looking, there's a lot of things that you can, and Jessica brought up these newer technologies, which I think are going to be very helpful for veterinarians, particularly with exotics. Because the one thing, I didn't catch this, Jessica, if you said this or not, but most cultures are designed for a dog and a cat. Mm-hmm. And I learned this from Bless you, Dr. Bemis, because he's passed away recently and I miss him terribly. But he told me, so Susan, what's the temperature of a bird? It's 105, right?
Mhm.
So so then the setting of the culture is for a dog and cat temperature. And he told me a long time ago at the University of Tennessee when I was working with him, he knew that he would have to wait 2 or 3 more days before the pathologic bacteria would grow on that system for a bird. So, and because of that, we did a lot of number of things. So some of them will grow, and then as Jessica, she started saying, then I had to run over to deal with the baby. But you know, there's anaerobic cultures, there's aerobic cultures, there's fungal cultures. Some of them are tricky. And so that's why I like what she was talking about, this newer technology, because I don't have to worry about that. And I can get that all wrapped into one sample charge instead of, oh, you know, it should have been an anaerobic culture, or, you know, that kind of thing.
Is that lab My Dog for that?
I use My Dog. I don't know, Jessica, what do you guys use?
Yeah, yep, that's the one we've been using.
Okay, yeah. So I use My Dog. And because of this culture issue, and it gives you fungal organisms, it can give you chlamydia potentially, but then we also have these PCR tests. So in these birds as they age, I may be doing a profile more commonly, or the CBC was a little off, so I repeat the CBC or the PCV because that helps me look at heart disease too. So it's really, I really feel that as clinicians, these tests will end up being tailored to the patient and the patient's needs.
So are you saying that, you know, we do a lot of routine lab work when a bird first enters our system, you know, fairly
Absolutely true. First enter your system. Let's get a baseline.
Okay. But do you recommend that we also do a cloanal swab to get that kind of detail that you're talking about?
I would just do a choanal, and a fresh fecal gram stain.
So do a cloanal swab and have it sent to My Dog if that.
No. I wouldn't spend the money for anything like that. I would do gram stains, a choanal and a fecal. And so I have to take people like Jessica and teach them all, because see, they lost sight of that great technology.
But you have to do a swab to do a gram stain, is that right?
Correct.
Okay, and then you put it under the microscope in the vet office, or you send it off?
Oh yeah.
Okay.
So here's the reason why. The reason why is
New Steve's protocol.
I like it.
yeah,
all
there you
yours.
go. Jessica, you gotta change it. And the point
I can
is,
tell everybody.
okay,
Yeah.
so she talked about avian gastric yeast. Can you culture it? No. Do you have a lot of yeast that you can culture? No, not on a standard culture. And you are people think that a lot of birds get sick because of they really don't. They just go to Baytril. But Baytril is an antibiotic designed for aerobic bacteria. In my experience, in my area of the country, I don't know what Jessica does, but in my area of the country, most of the time they'll have anaerobic bacterial populations because of the changes in the GI tract. As they start to get sick, the GI tract slows down and you'll get more anaerobic bacteria. I also live in this area of the country, which was the Black Swamp. So Dr. Kathy Johnson-Delaney was just here visiting, and she said, my God, everything you look at is fungal. And I said, well, go ahead, Kathy, and I'll show you. And she said, you're absolutely right. Everyone, particularly this time of year, when those harvesters get in the field and the wind gets going, it has to be wind related because everybody's on a different water supply and everybody feed their birds something different. But my God, they have these yeasts, which you are not going to culture. Dr. Bemis and I did a lot of work on these small yeasts, and they don't culture. But do they create problems? They sure do. And most veterinarians don't even know to look for them because they've lost the technology of doing a choanogram stain.
And so we'd see that anaerobic bacteria on a choanogram stain. Did I get
Yes,
that
and the
right?
other thing that you'll see is you'll look at the quality of the cell. So that's what Dr. Spear was talking about. So I'm looking at the quality of those cells. Are they basophilic? How basophilic are they? Are there eosinophilic? Is there mucus? Are there other types of cells there? Are there fungi that are mycelial, which is what Asper is like, a mycelial phase, which is like strings, or globoid, which is like a yeast. So I'm looking at all that stuff. And I'm looking at all that stuff when I get to the fecal gram stain. I'm not just recording like the microbiologist is just looking for organisms.
Mhm.
And every microbiologist worth his salt will always do a gram stain of the culture that you're submitting to them.
And we're going to see the yeast, the anaerobic yeast.
No, they may not be anaerobic, but they're just separate. You'll see anaerobic bacteria and yeast on that gram stain. And you'll see if there's a lot of problems with mucus. You'll see the quality of the cells, because as those cells change form and the infection gets worse or the nutrition is bad, you will see that. You will see that in the cells, but you have to train yourself to see it.
Right. Okay, so just to repeat, since we don't have but 2 veterinarians with us today,
Yeah, that's fine. That's fine.
they will ask their veterinarian to do a choanal. That's the back of the throat.
Choanal, C-H-O.
Choanal swab, which becomes something put on a slide to look at under a microscope as a what's called a gram stain.
I will bet you, Anne, if they don't know what that
right?
is, they don't know how to read it. They don't know how to interpret properly.
Right.
And Jessica, I don't know who else would do that, because see, I do thousands of them a year.
Yeah, no, I can certainly do that. Yeah.
Well, we have people from all over the country, maybe even the world, online now, and I just want them to know exactly how to ask their veterinarian what to do.
It's the roof of the mouth. It's the choanal slit. So there's a slit in the roof of the mouth, and I take it very quickly with the cotton swab from caudal to cranial, from back to front. Whoop, quick. Roll it on the slide, and then I do since you go like this, I also do the end of the cotton, and I dab it on, and I put it on the one part of the slide. Then the other part of the slide, I'll do the fresh fecal, separate cotton tipped, separate cotton, a cotton tipped applicator. Okay. Then heat fix it, then stain it. And
Heat fix it, very important for anaerobic. You've taught me that.
Well, heat fix it for anything when you're doing a gram stain. Now, when you're doing a cytology, completely different. You don't heat fix something for a cytology, okay? And then you look at the slide. Now, people like Giacomo Rossi, people like that, they are into that.
Why they've learned so much in their research.
Yeah. So if you're the veterinarian, and they can listen to this, you want the cells to be lightly basophilic, AKA lightly blue, to lightly red, which was eosinophilic. There shouldn't be mucus. There shouldn't be an occasional gram negative, or not gram negative, but a gram positive bacteria, never a gram negative, particularly if you were working with Dr. Harrison, who would say the same thing. And no mucus. There's no mucus, no yeasts. There's just a few bacteria in there, maybe a very occasional yeast. That's normal on a choanal, C-H-O-A.
So this will be recorded and put online. And those of you who want your veterinarians to hear this exact instructions, you can go back and have them listen to this. This would be great. So speaking of fecal gram stains, the bacteria, people, I always share the lab results with our foster families, and inevitably they have the question of, oh my gosh, too much positive this bacteria or positive that bacteria. And I always say, but that's good bacteria. That's not a bad thing that they have that bacteria. So can you explain a little bit for everybody to understand about the negative and positive bacteria, and when the ratio is too much or too little, when
Okay, I missed some of that because I checked the baby. But
we want to
but-
see the baby.
hey, okay, Eric, can you bring the baby? Can you bring Mr. Lennox over to say hello to everybody?
I've only seen 2-day-old baby. I haven't seen
Okay.
2-month-old.
He's well, no, he's on 5 months now.
No. Can't be 5 months by
He
now.
can't- Okay, here comes Lenny. Yay! There he is.
Hi, baby.
Lenny.
That's so cute.
Hi, Eric.
Hi there, how are you?
So anyway, so if you had learned from Dr. Lefebvre, Ted's dad, or Dr. Harrison, when you looked at a fecal gram stain in a parrot, not something else, then it should be a nice population of gram positive rods and some occasional cocci. And they should be rods that are slightly long. When they get short and fat, then they become anaerobic. And you can see Clostridium, you can see Clostridiospores, you can see these avian gastric yeast, which are big long honkers. You can see filamentous rods. Those are all not right. You can see other types of fungi. You can see a bird that's not digesting well. There's a lot of undigested particles in the fecal. So you can see all those different types of things.
So with negative,
And just to complicate you, Anne, with the avian gastric yeast, you can use a Calgi swab and swab down in the crop. And I'd like to do some crop swabs. And I do cytologies and or I do gram stains of those for certain situations too.
we really need that microscope here so you guys can come visit.
Yes, you do.
So what is the ratio? When does some presence of negative bacteria become cause for concern? So people understand how to
As
read
soon
the
as you
result.
get negatives,
Because there's often like 2% negatives or something.
they shouldn't be there. Something's not right.
If there's any negative bacteria, something's not right.
If you were me or if you have a bird that's in a cage in somebody's house, it's not right. Now, if you've got this bird sitting outside and he's eating dirt, different story.
Mhm.
Okay, if they're eating dirt and doing some other stuff, different story.
And so
The
any
most
negative
common
bacteria
problem, though, the
means
most-
probiotics at that point.
yes. Oh, and I'm trying to get some information from Italy. Dr.
On the
Ross,
Civimix?
yeah, the Civimix people. Did you get the thing about Dr. Ross is going to do two big lectures?
But it was dog and
Unfortunately,
cat related.
well, it'll. Oh no. Zooming around here. If you like zooming.
Just
Yeah.
while, so everybody knows Civimix is a Italian probiotic, which has very unique bacteria in it that can't be found in any other probiotic in the United States. And Dr. Rossi, who's a brilliant
And in
Italian,
high concentrations.
he says it's the best, especially for those birds who have ganglioneuritis, which is the new, more improved term that Dr. Orris created for PDD, which I was glad to see you using today. So we're just waiting for it to be more available in the US and especially in the new liquid form, right? Did I get all that right?
Yeah, that has MCT oil in it, the medium chain triglyceride.
Which is
Oil
coconut
with
oil,
it.
basically.
Yeah. So, but that's going to help keep this GI tract going. So what you're looking at, it doesn't matter if it's a ferret, a rabbit, a bird, different types of different types of animals have different types of GI tracts. And our parrots are frugivores, AKA, I have to use the word fruit, but it's not the fruit that Americans think of as fruit. They're fruiting bodies and there are other types of structures. And Jessica, she did such a wonderful thing with the GI tract. I love that.
Cool.
And then you could see that mixing of that ventriculus up into the prognos, fabulous stuff. And so all of that, what she showed you has to be correct and it has to be working properly in order to have the right milieu of bacteria. And so different types of diseases, viruses or bacteria can, parasites, infiltrative things can cause, that's why she's doing this necropsy to figure this out. Then it alters that motility and lo and behold, you see something on the gram stain. You may not know what caused it, but you go, uh-oh, I need to start looking deeper.
Mm-hmm.
That's the most common problem. You know the GI tract is slowing down when there's a bunch of anaerobic bacteria.
Which is not something we normally see through most.
Well, you see it only occasionally. Now, and one of the common reasons you get a whole bunch of anaerobic bacteria is when the bird is hormonal. Because you don't shit in your own nest, Anne.
We should know that from all those, wild birds we've seen.
We saw, remember how Navis was concerned about that one hen because there was poop inside of her nest. You won't see poop in a nest box. So they have to enlarge their cloaca, they have to enlarge the distal end of the GI tract, and they have to let the fecal contents sit there for longer periods of time. What happens? You get anaerobic bacteria.
Mm-hmm.
What do owners say? My bird's feces start smelling and I have these big poops.
Mm-hmm.
That's Clostridium.
Mm-hmm. And Clostridium's a problem, isn't it?
It can be.
Dr. Rossi thinks it might be one of the triggers for ganglioneuritis, right?
No, Campylobacter.
Campylobacter, sorry. Campylobacter.
Yeah, Campylobacter.
Clostridium is the one that Dr. Dahlhausen says to use the Spectogard for.
Right.
Which is the pig medicine.
He's the Spectogard king.
Yeah, and it does. It works great.
It works great.
And it's great because you can get it off the shelf. It goes right through the system. It doesn't cause any antibiotic other issues. It's
right, because it stays just within the GI tract.
Right. Yeah. Spectogard. Spectogard for those of you listening. I think that's how it is. Spectogard. Yeah.
Spectinomycin for the veterinarians.
Right. So do you think that it's possible for U.S. veterinary offices to soon get the probiotic Civamix so that more people can benefit, everyday parrot people?
I can't tell you what my answer will be. I'll email Florence on Monday. She's away on a trip.
Because there was talk, I think, about them exporting it soon, potentially.
Yeah. The big holdup is typically the United States.
Yeah. I mean, veterinary offices can now get the capsule version, and I wish more would because I think it's such a great probiotic. Yeah. So all of that is dependent on when the USDA will allow them to import it. Short of that, just for people who are listening, Visbiome would be the next. Yep. Because I don't see. And that's a dog and cat product. Right. But the Civamix has that extra
Yeah, I think it's 2, but it could be 1 bacterium that Giacomo thinks is important. Now, the other thing that I want to say about that, we're monopolizing poor Jessica. She's like,
That's okay. No, I'm
these
learning
guys
so
are
much too. This is
boring.
great.
So the reason that Ann and I are so high on it is because there's actually science.
And we trust Dr. Rossi so
Well,
much.
because he actually did a number of studies. He did studies in chickens, he did studies in some owls. And then he went and did with Livio Pelosi, his resident, he did some studies of young baby parrots that were being hand reared. And so they gave them what they would normally do, which was no probiotic, and then they gave them the SIBO mix in essence. And man, I mean, I'm not good with my computer, so I don't know how to bring that up, that picture. But boy, is there a heck of a difference between the ones that got SIBO mix and the ones that didn't.
It was closer to the parents actually feeding them with all the natural probiotics they actually need.
Now, when I gram stain birds like that are on it, I really don't see it in the fecal. Just to let you know, I don't see them.
Okay, so to go back and recap for everyone here, if a bird shows any negative bacteria, some kind of probiotics is probably useful, if not necessary. And Benebac, something off the shelf, short of one of these other ones we've talked about that are so much better?
Jessica, I'll answer that.
Okay.
From a long time ago. So, you know, I keep invoking the name of Dr. David Bemis. We did that study a long time ago. In that study, around 1995 at the latest, we actually I went to the store, I bought Benebac, and we put it in a culture plate and it did not grow.
When was that?
1995, probably.
Just so, you know, all these years
I don't know
later.
if they've changed it, but in 1995, it was deader than a doornail. I don't know now, but I can tell you back then it didn't work.
I think Necton is another one off the shelf.
That's a vitamin.
Okay. I think they have a probiotic now. And well, what
Do
do you
they?
guys recommend to your clients?
I have SIBO mix.
I wish I could get this SIBO mix stuff now. This sounds great, but I usually recommend Visbiome. That's what we got.
You do
Yeah.
have it there? Okay, that's great. That's fantastic. I will send people to get it from you. Not many vet offices have it.
Yeah.
Yeah,
No, it's
great.
stuff.
All right. Graham, no. So there was a question about the percentage, but you guys are saying that any percentage of negative calls for some remediation. Is that what I'm understanding?
That would be me, because I've been gram staining since 1984.
And then are there certain foods, if there's some negative bacteria they should take out, you know, or yeast, like when there's yeast? I've seen birds get yeasty when they had too many antibiotics, for example, you know, and no counter to that.
I mean, Jessica, tell me, I think it depends on the situation and the diagnosis. For sure with
Totally.
yeast,
Yeah.
you know, those are birds that could potentially have lots of sugars in their foods.
Mhm.
So then you think fruits, American fruits, not
Carbs. Everybody's feeding pasta and pizza and
yeah. So there's plenty of those things. When you have a gram negative, they're pretty sick. You got to address the sickness typically. Anaerobic, they could be hormonal, they need more fiber in their diet, you know, that type of stuff. Less stress, just depends.
I've had really good luck with caprylic acid, which is available in Whole Foods or whatever. It's just for yeast. They sell it for women, for yeast for women. I've had really good luck with it with birds too.
Now, do you put it in their water?
In the food, it's a
their
powder, a capsule, and I just sprinkle a little bit.
Yeah, because what you're trying to do, the one thing that we haven't talked about and because we don't know enough about it to talk about it, that's our problem, is that, because I know Jessica, she's young and she's been fascinated with this question for a long time. As this young person thinking at night, in the middle of the night, she's thinking to herself, why do birds in the wild, parrots, who live with high heat and high humidity, why don't they get sick?
And high fungus.
Yeah, they don't get Asper, right? They don't. Not in the wild. Pretty
Yeah,
unusual.
why? Do you know the answer to that?
No, but I'm suspicious. I'm suspicious that part of the answer is we are what we are by the foods that we eat, right?
Yeah.
And I'm suspicious that they're eating, as you said, with your caprylic acid, they're either slightly acidic, their bodies are acidic, because they have that high internal body temperature too, right? 105.
Non-ripe fruits.
So the 105 temperature probably helps them because it kills off some of those bacteria. And then they're eating things that can alter their pH of their bodies. Now, the other thing that they could be eating are things that keep them from getting infections. And we know we've seen instances of animals self-selecting herbally for different things based on certain situations, certain medical situations.
Yeah.
So that's why I let people put some apple cider vinegar in their water or spray them off with apple cider vinegar, because we tend to live in a very alkaline environment. And then they're selling these damn alkaline waters. Yow. I mean, you know, different people have different pHs. I mean, different people grew up, and I know I have to run acidic or I get sick. If I stay acidic, I don't get sick.
Acidic mostly because our fruits and veggies don't have enough alkaline anymore. Doesn't that kind of affect our bodies?
No, I want to be acidic, and I don't want to be alkaline.
But too acidic is not good either, right?
Too acidic is not good. Yeah.
I always recommend people buy the really firmest fruits and veggies, especially things like cantaloupe. They break down really fast and they get real mushy and
Mushy.
yeasty, especially if you're making something, you know, for a day or two. But like we saw in Brazil, you know, the macaws were eating the very hard
Unripe fruit.
Yeah, very hard. So, well, this has been supremely interesting, right up my wonderful, my alley of interesting topics. Grateful to both of you.
Hey, and Jessica, can I borrow your template?
Oh, absolutely. Yeah, go for
I
it.
love it.
Oh, thank you.
I love it.
I was telling Anne the other day, I wanted to choose something that was a little more like, you know, celebration of lifestyle, because we're talking about death, which is so sad. And so I was like, I think flowers, you know, this is a pretty template.
Oh, this is lovely. Yes.
Yeah.
But you know, I know Jessica did a very good job talking about that. We as veterinarians, when you allow us the opportunity to look inside that lovely body, it helps us learn something always of whether or not we were working at the right diagnosis, or there's a big surprise in there that we had no idea about, or there may be nothing. We might not see anything because the brain, we haven't included the brain in this, in many of the necropsies. It's just very, very difficult. It deteriorates too rapidly. So that's always been kind of the outer reaches of the necropsy. But it really helps us. And we do those at our veterinary hospital on any animal that we're following that we would like to understand more. And we found some very interesting things which has helped people kind of feel good about that decision that they had to make, or that they found their bird dead and, oh my God, did I do this, or whatever. It helped them come to closure.
It wasn't their fault. It was.
Yeah.
Yeah, absolutely. I think a lot of my clients, they'll even sometimes say, I don't want any necropsy because I don't want to know if I did something wrong. And I'll tell you, I don't think I've ever done one where I found like an owner was to blame. And that's just, if anything, like Dr. Roras was saying, it helps us learn. It can offer closure. It can just help in so many ways. So if that's, ever something you're worried about, I wouldn't even stress about that, because I've never seen something where, I pointed and said, like, yeah, that was, it's not about placing blame at all.
It seems like we've had a lot of cockatoos with inconclusive necropsies as a species. They seem to stand out. I mean, do you guys find any particular species being less determinate in a necropsy?
Not really. I try to do a fair number of necropsies, and I can't say that I've seen like a species pattern for inconclusive. And I honestly, I do necropsies on a lot of my patients. I see all exotics, not just birds. And birds in general, I find to be one of the types of animals that I necropsy that I almost always find something wrong. It's pretty uncommon that I'm seeing something. I don't know. That's just my experience with it, but yeah.
Heart, liver, kidney being the top.
You got it.
Exercise and diet.
Exercise and diet.
Yeah. The one thing that I had to run off, but I would say exercise is really a huge problem. The lack of it, I should say.
Yeah.
Which is why we're following up next month with Chris Shank from Cockatoo Downs.
Oh, I love Chris.
People who can safely fly her birds outside. It's not something for everybody, but flight is super important to her. And being, and
she'll admit she's lost a bird.
She has lost one bird, I think. Yeah.
One or two maybe, but, and she's flying cockatoos.
All cockatoos.
They're white, they're easier to see.
Yeah. She's very passionate about how birds are bred or not, how they're raised, that they be given the right first start, that they get a chance to learn to fly, etc. So I hope everybody here today, plus many more, will join us next month for that.
When is that, Anne?
I think it's December 10th, if I recall correctly. I think it's the second Saturday. We try to avoid the last couple of weeks in both November and December because of the holidays. Everybody's so busy.
Okay.
Yeah, so you'll have to come back. Hopefully, we love it when you join us.
Well, is it a Saturday or a Sunday?
Saturday 1 to 3 is our traditional time.
Okay. Yeah. If I can find, or I might bum off of Dr. Eccles. He has some amazing CTs of particularly cockatoos that their bones are falling apart because they don't fly.
Especially the Moluccans. Yeah, bring that. I'm sure Chris would love if you would chime in at the end with some of that evidence. That would be great. Yeah.
That's why I can't stress that enough. And as Jessica was saying, Dr. Jessica, when she's talking about how, they get this cholesterol plaque and all this, a lot of that is based on the fact that they were designed to fly. So their brains are wired for fuel to allow them to fly. That means high fat, high protein. And then you, the human, said, oh no, honey, you're not flying. You're sitting on your perch all day.
Yeah, here, let me give you everything. Yeah.
And so, and so birds are going to, even humans, for God's sakes, we select for fat and protein. I mean, we love fat and we love salt, right? So there you go. And the food manufacturers know that. So it's hard to get them with a low enough fat to get rid of the problem, because the problem is really centered on flight. So the brain is geared for flight and the body isn't able to fly, and that's where the crisis comes in. So the more flying they do, wing flapping, whatever, the less likely you're going to see atherosclerotic plaque. And it doesn't matter if it's a raptor that they put in captivity because it has an injured wing and it can't fly, or the parrot, their body, their skeleton's going to fall apart.
Yeah.
In your experience, would you say that birds that are mutilators, that actually pull their skin, usually have some medical reason versus some psychological reason? Something, either bones like Dr. Eccles has shown, or heart. I mean, that's been our
sometimes, just like
in
in necropsy, sometimes we can't find it.
I was just about to say, so I strongly suspect that whenever a bird's mutilating, there's something going on that's causing pain or some sort of reason they're doing it. But unfortunately, not everyone can afford a CT scan, which is one of the main ways that we diagnose if there is an issue there. Or sometimes people don't want to put their bird, through the anesthesia for the CT scan. But even you can do a CT scan and you may not find what's actually going on. You can do all these tests and sometimes not find what's going on. But I do suspect that there's probably something more of a medical reason for when they're actually like mutilating the skin, versus a psychological reason. But that's just my own kind of.
Right. And I agree with Jessica on that. Although I have taken some video clips of birds mutilating themselves, and I have to say to you that I showed them to some psychiatrists and just said, pretend this was a human. Tell me what you think. And they think that there's the possibility they could be, that they've independently said they're kind of like people who are cutters. There's a psychological problem because they're there was a term, a description of what we use in neuro a long time ago, where the pain is such that they want to get rid of the pain, so they inflict greater pain. And so that can be happening as well.
Yeah, one of our adopters is online today, and they have a mutilating Moluccan who's about to go, I think this week, undergo tail surgery based with Dr. Richie Bordeaux, based on Dr. Eccles, explanation of how that pain from the tail and infection and all that can cause mutilation in other parts of the body. But that's been our experience too, that it seems like it's always internal, something internal is going on. It's not just feather destructive behavior. Speaking of which, Dr. Bordeaux is going to do his feather destructive talk in April, I think it is. So
fabulous.
Yeah. Fabulous. Lining up a good cast of folks for next year. Keep everybody on the learning curve, which I have benefited from greatly today. You are both remarkable, wonderful people and veterinarians.
Oh, Jessica, you're just fabulous.
Oh, stop. You
guys are trying to see her.
We want her. Nice lecture. Very nice lecture. What I could hear was terrific. We really appreciate young people going into avian medicine, because as I'm kind of slowly winding down, it's so nice to have such wonderful people like you.
Oh, that means the world. Thank you so much, Dr. Oros. And thank
welcome.
You for everything that you've taught me. For those of you who don't know, Dr. Oros generously hosts a lot of us avian residents once a week and teaches us avian medicine and as guest speakers. And so I continue to learn so much from you and look up to you so much.
Well, thank you. But, we're all trying to, if you guys pass that damn test. Oh,
yes.
Oh, Jesus.
Oh.
We need both of you around for a long time. That's all.
Yeah, we need wonderful people like Jessica, caring avian veterinarians. That's what we need.
Yeah.
Because as the audience, I don't know who we have left. We probably have nobody left. The thing is
hard.
we are entering a crisis in veterinary medicine, and we're certainly entering a crisis in the field of avian medicine. And we could sit around and talk about that some other time over a Zoom, and we could sit down and have a coffee and have a coffee talk about something like that.
Sounds good. We should just have a Q&A sometime for everybody.
Yeah,
there are a lot of people out there who just have general questions. It would be a great thing to think about. I'll hit you both up for that for next
I'd
year.
love
How about
that. I've even got my coffee right here. I got my little bird mug.
There you go.
I love that. I love that.
Yeah, just a general Q&A. I've been trying to get Rosemary Lowe to do that too, because she's just
Oh,
so
we
smart
have
about
got
wild
to
birds.
get, now have you gotten Rosemary to do one?
We have been practicing Zoom. She just hasn't quite got that yet, but
Can
I'm
someone just,
hoping that she'll just
can
call
someone come
in.
over and help her that day?
Yeah, we're working on that. I just think she's got so much in her head
Oh my
about
God, yes.
decades of research.
You know what we really need? I can't remember, where does she live in England? Do you remember where?
Central area.
Because what would be a wonderful thing. So we need to stimulate somebody to go over there that is good with a camera. We should have Jessica go.
I've
And
been promising her I'd come stay with her sometime, and then COVID hit, you know.
well, what you want to do is take about a week, and every day you go out, because every morning, you saw when she was with us before, she goes out every morning and walks the countryside and collects foods for her birds.
Mhm. Crimson-bellied conures, as I recall. Yeah.
Yes. And she was there in Asheville, and and that's what you want. Oh, Rosemary, what is this? Now, why do you use that? When do you use that? And the problem is you kind of need to do it, spring, summer, fall, right? To kind of get an idea of the stuff that she's done. But oh my God, would that be doing some videos of her collecting those foods?
Yeah. I think she's walked the earth she's walked every bit
She's
of
walked
earth
the earth.
where a parrot lives. She knows every wild spot that a parrot lives, and she's just remarkable. It's so wise. Anyway, that's on the hopeful agenda for next year too. And wouldn't it be
Oh,
nice
fantastic.
if you could join us for a Q&A type thing where we could compare wild and captive issues? Because I know Don Brightsmith has said, conservationists who we followed for many years, that birds are dying in the wild faster than he thought. Mostly they're fighting over mates and nests, not from disease. But we've often talked about comparing why birds die in captivity versus why they die in the wild, and some of that kind of interesting dialogue too.
Well, when you talk to them about that, the reason they're fighting, I would suspect, is because their space is shrinking.
Exactly.
If their space enlarged,
Exactly. It wouldn't be the same.
then there wouldn't be such pressure.
Right. Exactly right. Exactly right. It's happening everywhere, unfortunately. So parrot people, do something for conservation. We all got to
Absolutely, every day, and even for the wild species in the country that you live in.
Yeah, we all got to do something for the things we love most that are in danger. Yeah.
Yeah.
Well,
Okay.
thank you,
Well,
guys.
I should go check on the babe.
Okay, Grandma, we appreciate you being here today.
Yeah, thank you
Okay.
so much for popping in, Susan. Good to
Oh,
see
Jessica,
you.
you're so fabulous. I'll see you later. See you.
Thank you so
Well, not
much.
next week, but the following week, honey.
Yes, in
Yeah.
2 weeks.
Okay. See you then.
All
And
right,
don't
see
forget,
ya.
Okay,
the new
bye-bye now.
protocol in Sieves is to
Yes,
do
new
a
protocol.
parental swab and
Mhm,
a
absolutely.
gram stain. Okay. Thanks, everybody. I'm glad you were here today for this very enlightening discussion and for a remarkable and stupendous presentation by Dr. Magnotti. We all wish you lived near us. So
Oh, you were too sweet. And thank you so much for hosting me, and for everyone who's stuck on. I see you still have 29 participants. And,
yeah,
so thanks everyone for staying on, and hopefully you learned something. And thank you again so much for having me.
pleasure as always. See you soon. Thanks, everybody. See you December 10th. Come back. Bye.